Hello, my name is Alexandra Mountford. I'm a third-year student in the pediatric concentration of the Yale School of Nursing Master's of Science in Nursing program. I'm going to tell you about my research project entitled Impact and Exposure of COVID-19 on Early Childhood Sleep in a Socioeconomically Marginalized Community. The COVID-19 pandemic has disproportionately affected marginalized communities, further highlighting the longstanding health inequities that exist in these communities. Understanding ways to understand and mitigate downstream effects of the pandemic in early childhood is a critical public health concern. Initial reports of the effect of the pandemic on children's sleep has been mixed and primarily reported among white children living in middle-income families. Our study aims to examine the association between the COVID-19 pandemic and sleep among children living with socioeconomic adversity. This presentation is a report of our preliminary findings from a cohort of a larger follow-up study on families who completed a longitudinal study conducted from 2015 to 2019. We received IRB approval to reconsent the 110 primary caregivers who participated in the previous study and are aiming to recruit 70 families in this cohort. We repeated measures from the first two time points collected from 2015 to 2019, including demographics, protective factor survey, sleep data, and biomarkers of stress response. The COVID-19 exposure and family impact survey was added to measure the parent-reported impact and exposure of COVID-19 on the families. This presentation will focus on the associations between COVID exposure and impact on preschooler sleep. Notably, the protocol was adjusted to meet COVID-19 safety protocols to protect participants and staff members. These included mailing the data collection materials and picking them up using social distancing. REDCap was used to collect e-consent from the parent and e-parent permission for the child to participate. Surveys were also collected remotely using REDCap. Our preliminary findings showed that higher COVID impact was significantly associated with less nighttime sleep. Additionally, compared to pre-COVID, there was a trend indicating later bedtimes during the pandemic. We plan to further examine this trend when the data collection is complete. In the meantime, this trend may be clinically meaningful and something for pediatric providers to target during their visits with families. These findings are based on parent-reported sleep data and planned analysis, including examining these relationships with objective sleep data. Furthermore, we have also repeated the stress biomarker data and parent-reported child behavior with the child behavior checklist. With the additional data gathered, we plan to further examine how children's sleep has been impacted by the COVID-19 pandemic. Thank you for listening to my presentation.